The study was commissioned to assess the future of malaria and elimination strategies, especially in sub-Saharan Africa. Some of the focus areas include the treatment responses of the countries ahead of the 2023 deadline.
Like in the context of Namibia, it's the issue of when do you treat a patient? Do you have to go in the community and look for cases or anyone suspicious to be having malaria? Or do you wait at a clinic or health center or hospital in order to make a diagnosis? Now, the finding from success cases like Rwanda, for instance, is that the healthcare workers who are largely community health workers, not doctors or nurses, they may have one nurse leading them, but it's mostly community health workers who go into the community and concentrate on symptoms and non-symptomatic persons.
But Namibia has since independence managed to reduce malaria cases by almost 90%, totaling an investment of about $10 million. At independence, surveillance systems reported close to 500,000 cases of malaria, 40,000 admissions, and 1,700 deaths due to the disease, according to Health and Social Services Ministry. President Hage Geingob, during a high-level malaria summit, further revealed measures that government has taken. The summit was convened on the margins of the Commonwealth meeting of heads of government in London.
We have managed over the course of 28 years to reduce malaria cases by almost 90%, thanks in part our budgetary commitments towards combating malaria, totaling $10 million in that 5 years. That means $2 million per year. Furthermore, our efforts to combat malaria have also been bolstered through the support of our development and implementing partners.
At the regional level, Namibia is the host nation for the Malaria Elimination Aid, which include Angola, Botswana, South Africa, Zambia, Zimbabwe, Swaziland, and Mozambique. Dr. Geingob says as incoming chair of SADC, Namibia hopes to leverage on the platform to further strengthen regional and continental efforts towards combating malaria. In addition, government wants to increase early surveillance to rural areas through integrated community case management programs. This is owing to progress in the fight against malaria stagnating across the world. In the case of Namibia, budgetary constraints are also a factor.
That's why we're looking at community health workers who are the most affordable in the system of care in the ministry. For one salary of a doctor or nurse, you can actually employ 5 or 6 community health care. Not that they are not important, they are. It's just that their level of training, etc., is not the same like a doctor. So therefore, they are much more affordable. So Namibia is affected by the financial constraint, definitely. You and I know very well. The health sector is not the only one, other sectors as well.
Without divulging much, the health minister said government is in talks with the Bill and Melinda Gates Foundation for malaria elimination. The foundation's activities include enhancing healthcare in developing countries. Blanche Corres, NBC News, London, UK.